So we're now going to look at orthostatic vital signs. We're going to see here if orthostatic hypotension is present. So we're going to have the individual in a supine position and we're going to be assessing for blood pressure and heart rate here, but primarily we're going to be looking at blood pressure here to see if when the individual stands, if there's a drop in systolic blood pressure or any other variations that we might then send on to the doctor. POTS is also known as postural orthostatic tachycardic syndrome, and it's characterised by tachycardia or an increase in heart rate when the individual changes from either being supine or laying down or in a seated position and then standing up. It's characterised in adults by an increase in heart rate of 30 beats per minute, and in adolescents and children this is 40 beats per minute. To qualify for the criteria to have a positive NASA lean test that might indicate this, there's also another criteria that you can refer to our NASA lean form to see if the individual fits that criteria. The individual will be in a supine position, in a resting position for 5 to 10 minutes. We're then going to get their resting blood pressure and heart rate in this position. Once we've got a baseline measure of the individual's resting blood pressure and heart rate, we're then going to do the standing part of the NASA lean test. The individual will go straight from a supine position to a standing position with their shoulder blades or their upper back resting against a wall. So Millie, what we're going to do is we're going to stand up straight from here, and then I'm going to get you to stand up against the wall here with your back gently resting up against the wall for me. We're then going to continue to measure your blood pressure and heart rate for every minute for 10 minutes here. We're going to continue to measure over this 10 minutes, and this is where we're going to be looking for the increase in heart rate of, in Millie's case, over 30 beats per minute. We also monitor blood pressure in this position as well, because if there is a drop of systolic blood pressure more than 20, then this then would mean that you wouldn't qualify due to orthostatic hypotension. Okay, Millie, so now we're going to get you to stand up and we're going to check to see if you get any increase in symptoms such as dizziness or lightheadedness, okay? So when you're ready, I'm going to get you to come and stand up for me. Stand close to the patient in case they do experience lightheadedness or dizziness. Millie, how do you feel here? Okay, beautiful. You're then going to monitor and assess blood pressure in this position for up to 2 minutes in standing to see if there is any change to that. After the individual has been standing for 1 minute, you are then going to reassess the blood pressure in this position.